Okay, this video is called What Do I Think of Anthony William Medical Medium? So, Anthony William Medical Medium is actually a very famous guy, and this is his book called Medical Medium by Anthony William. And how did I hear about this guy? Well, first of all, he's super famous. He's millions of times better known than I am. As far as I can tell from reading his book and looking at his site, he doesn't have much professional training. I didn't see any degree. Um, and then, so the question is, how did I hear of this guy and why am I making this video? Well, I have some really smart doctor friends, and this one guy is a top notch doctor. And he told me that he's following the medical medium and that he's been drinking celery juice at the recommendation of the medical medium, and his health has been improving, he believes, because of that. So I watched some of the medical medium's videos, and he's entertaining, but kind of has this unprofessional look, like he's wearing a t-shirt, and I'm not impressed by that. I know that's sort of a modern cool thing to do, but it doesn't impress me. And he's got all these like props and gimmicks, and I thought it looked kind of trashy. I wasn't impressed by it. But I decided to check the guy out and actually read the book, for the sake of my friend. Real bright guy, top 10% in his class, real competent physician and good guy. So I said, I'll check it out. So I read through the book, and it starts out, and he says that he communicates, almost sounded like seance like, with a spirit of compassion, and that he has a gift for understanding health. And of course, this all sounded to me like BS. And that he had a gift for helping people to get better. And I also noticed that he always plays it safe. Like, it's okay to say you believe in spirituality, but if you say you believe in God, people will maybe not like you for that, And I mean, a good example is, look at Jordan Peterson. In my opinion, he's such a weasel about a lot of things. Don't get me wrong. Jordan Peterson is pretty bright, and he does say some good things. He's an idiot when he talks about pharmacology and a lot of medical illnesses, but he's very bright on a lot of psychology stuff. But the reason I get into that, like, somebody will ask Jordan Peterson, do you believe in God? And he'll like go into this whole weasel, wishy-washy BS session for like 10 minutes. And I think he just wants his cake and to eat it too. But he does do some good things, and I'll give him credit for that, because he actually is really bright on a lot of psychology stuff, that Jordan Peterson. But what I'm getting at is, I'm always suspicious of people who try to play it safe and don't say who they are. Like, I'll tell you, I believe in God. If you don't like it, fine. Don't watch my channel. This is not a business. I don't care if you don't watch. I'll tell you what religion I am. I was raised Roman Catholic because my father's from Ireland and my mother's from Puerto Rico. So that's just how it is. Okay, there's tons of problems with the Catholic Church, but there's a lot of good things with it too. So you know who I am, okay? There's not a mystery or a game there. So somebody who wants to say, I'm spiritual, but I'm not committed to any religion, so don't not like me because of that, buy my stuff, okay, that always does not impress me. It just sounds like somebody who's being, it's a business thing to do, okay? And I realize in the modern world that's becoming more common. So anyways, continuing with this guy, he then says lots and lots of diseases can be explained by Epstein-Barr virus. And he includes fibromyalgia in that, rheumatoid arthritis, multiple sclerosis, and some other things. So that sounded bogus to me, because EBV, at least 90% of people are exposed to it, and probably significantly more than that. I like the fact he talked about dormancy. It's a herpes virus, and herpes viruses can be reactivated. And that's not a widely recognized thing, that viruses can be reactivated, and so can bacteria. Tuberculosis bacteria, Lyme bacteria, syphilis bacteria. And that's why you want to maintain good immune function so you don't get reactivation of a virus or a bacteria. That's a whole other topic. I talked about that a lot in my Douglas Kell video about mechanisms of prion proteins in the setting of cognitive decline and dementia and whatnot, and the whole iron oxidation stuff, which is pretty interesting. But, Douglas Kell is the best guy on dormancy of reactivation of bacteria. So anyways, going on with Anthony William, he also talked about some toxin exposures, and it was good that he did that. Most doctors don't do that. They're pretty ignorant of that. And he went into a lot of different types of heavy metal and other toxic exposures, which I thought was good. And there are some papers in the medical literature suggesting an association between EBV, Epstein-Barr virus, and multiple sclerosis and some other things. So I'll give him credit for that there is some scientific literature backing up some of his statements. He doesn't usually give references, even in his book, okay, where you'd expect more references. But what I liked about him was he was saying some different things. And, it's been my experience, you don't just, when somebody says stuff that's different, don't just dismiss them out of hand. Sometimes they're right. A lot of times they're full of BS or they're crazy. But, if you got a refractory situation where a patient is not getting better and they are doing whatever you think they should be doing, then it behooves you to check out what someone else has to say. Sometimes they're right. I remember when I was a resident, one of my surgery attendings said, just because a patient's crazy doesn't mean they don't know what they're talking about. Some patients, you listen to them, they'll tell you what their problem is, and you got to take their symptoms and their descriptions seriously. I wasn't that impressed by his cognitive reasoning. When you talk to a good doctor, you can hear bump, bump, bump. They logically build up a case for why their diagnosis is correct or their treatment is correct, and that's impressive. It makes you more confident in what they're saying. So anyways, I was sort of half leaning towards saying this book is a waste of my time. I'm not going to read it anymore. But then I saw some good things. First of all, he talks about diabetes, and he emphasizes diabetics must lower their fat. And the reason that's funny is all of the endocrinologists, not all of them, but the ones I spoke to more often, let's just leave it at that, I don't hear them recommending a marked reduction in dietary fat. So that suggested some wisdom. I actually wouldn't be surprised if he has a doctor buddy who helps him to write these books, because there is a wisdom and a knowledge that's greater than one would expect. There's sort of this comprehensive survey of disease, and it takes some knowledge to be able to do that. And that's not something even a junior doctor typically is capable of doing. So there's some wisdom there. And I looked at his recommendations. He did a good thing recommending a plant-based diet. And so I thought that was funny. So I did talk to my friend briefly about him. I haven't gone over him in more detail yet, which I will in the future. But that, he said some good things. Eat more plant foods, avoid all these animal products. And he also recommended avoiding a lot of things that most internet doctors, you won't hear them saying, avoid soy, avoid corn, avoid heavy metals, avoid MSG, avoid whey protein, avoid artificial sweeteners, fish oil, canola oil. That's good advice. Don't get me wrong. Organic corn can be good, but I certainly wouldn't eat the non-organic corn. Let's see. And he does recommend lots of supplements, which I think he overdoes that in a big way. Including coconut oil and zinc, a whole bunch of things depending on the specific condition. But that might also why is this guy super famous? Maybe that's it, because, corporations are going to promote you if you promote their products. So that's one quick way to get a lot of promotion. I don't promote anything. And that's partly why I get almost no views, compared to most nutrition doctors or other internet doctors. That's okay. I know I'll never be part of the glamorous set, but I do think I can make one of the best nutrition health websites on the internet. There's a couple other really good ones, but I'm gonna try to be one of those, even though that probably comes with the price of never becoming too well known. But that's okay. I'd rather be good than popular and not good. Let's see what else. So the bottom line is, I'm not too impressed by his logical reasoning. But I have to give him credit. He is recommending a plant-based diet and avoiding a lot of stuff that I would agree with him is bad. So, my friend's better off with his advice than they are with the advice of most doctors or with most internet so-called nutrition experts. So I'll give him credit for that. So basically, if I had a patient or a friend who had a reasonably good, explanation for the disease, like a high-fat diet, and they were responding well to a reasonable approach like taking on a vegan diet, I would just say stick with that. But if I had somebody who was not getting better, or maybe the diagnosis was wrong, would I be willing to go look back at his book and see if I was missing something? Yeah, I would. So I'm not recommending his book. I'm not recommending his style. But I am saying is, this guy's no idiot. And he does have some interesting things to say. I'm not that big a fan of making smoothies and stuff, because you diminish the fiber when you do that. But if you're not otherwise going to eat the fruits and vegetables, then fine, make a smoothie. So anyways, that was kind of interesting.